So when the doctor selects the print button, the prescription will be ready for printing, or you can able to save it to a local device, or either send it to the printer. So I'm just saving it for reference. So here you can view. So this is the format of the prescription that will be generated by the system. So the doctor name, the doctor study, his specialization, his address, his contact details, and the will be in the right side, and the left side will have will be having the clinic or hospital logo, and the hospital contact address details, and the hospital working hours, patient name, and the initial clinical notes which has been captured, and the prescriptions will be added here. So with this, the prescription, the patient can go to the pharmacy and they can get the medicines or drugs which is prescribed to them. So in the next scenario, we can see how a doctor treats the old patient. So if it is a case of old patient, the patient will be having the existing patient ID or the old prescriptions. So with that, we can able to find the patient, and the doctor will be capturing the initial details again of the patient. So I'm adding some dummy data. And once the initial level detail is added, the doctor will be analyzing the patient for the present illness, and the patient is came with a high fever. So after analysis, doctor will be adding the patient clinical notes. So again, these are the dummy clinical notes that is not associated with any disease or anything. So this is just for the sake of our demo. So once a clinical note is added, doctor will be saving it. And since the existing customer and we have already captured the medical history, the doctor will be directly going for the prescriptions. So since there is no medical test is conducted, or the patient is not yet ready with the medical test results, no, the details is not yet captured yet. So doctor will be prescribing for the temporary relief of the fever. So these are the dummy drugs that are not associated with anything. So once the prescription is created, the doctor will be viewing the patient details. So we can view this. Since this is an existing customer, I will be showing how to view the patient metrics for various states. Starting from January to present date. So this will pull all the medical records of the patient from the existing. So you can see his latest visit is on today and yesterday, and on 17th of ninth month. We can also find how the blood pressure and weight is getting varied for each of the visit the patient is visiting, and the existing test which the patient is conducted and diagnosed. So the patient is suffering from cholesterol and diabetes. So the status of the disease will be shown at the date of the test results entered, and the clinical notes which the doctor has added at the time of the patient visit, and the prescriptions which was prescribed to the patient. The prescription history also will be taken pulled by the system and will be shown to the doctor. So for printing the prescription for present date, the doctor will be going for a particular date range, and when they click on the view patient, so waiting test. So the doctor can print the prescription for this. I'm just saying it for the purpose of creating the or generating bill in the pharmacy. So I'm just logging out now, and I'll be logging in as a lab technician. So the lab technician will enter the master disease name. So I'm entering for typhoid now. So the master detail is added. So I'm going for adding the medical test for the typhoid. When we type here, the system will detect what we are going to enter for the master disease name. So the sample dummy test for this is I'm going to add for some summary data. So this OS all the for both gender. Or we can add for male for now. So 80 to 160, and above normal is 160 to 180, and very high is 180 to 200, and very higher is 200 to some max value. So I'm adding another row. So this is for another test for the typhoid. Is the dummy test and dummy data. So these will be entered by the lab technicians. It's a one-time entry for. With this pre-entered data, the doctor can easily diagnose the test results, and the system can provide the various data visualizations of the data present in the system for the patients. So this will be the same. So once the test results is entered, so this is a job for the lab technicians. So I'm logging out, and I'm going to log in as a pharmacy user now. Once the pharmacy user is logged in, they will be directly shown the billing page. So before billing, I will be adding the some medicines. So the category we can give for this is, so once I added the category, I'll be proceeding with and so just adding the dummy data supplier, dummy supplier for our drugs, and the epidemic drug and the medicine name. So these are dummy datas. I'm going to add. So these are dummy datas, dummy medicine that are not associated with anything. So number of strips. I have bought some 10 strips, and number of units per strips is, in one strips I have 15 tablets, and price per strip is 250, and the container I am storing it here in C1. Route of intake is oral, and strength is 250 mg, and the manufacturing date is September 1, and I'm going to give it as an expiry date in April 2024. So I'm going to add for another medicine. So these are again dummy data. So I'm going to leave it. I'm going to change this price alone slightly. Okay. So it is stored in C2 container, and the strength is 200 mg. I'm going to leave the manufacturing expiry date same. So once the medicine data is entered, so now we can proceed with do a billing. So a patient, so our first patient, Alex, comes to the pharmacy for getting the tablets. So this, since Alex is an existing customer, we'll be having him in the no system. So the system will automatically pull his details, and we are going to provide Alex with. So the system will automatically pull the details of the tablets which are in our inventory. We can find the strength, and we can check the total quantity available in our inventory, what is the expiry date, and where the tablet Pulmoclear is stored in the storage container or storage box. So Alex needs 5 days for two, which is 10. So we are providing him 10, and when you are adding, the system will automatically calculate the GST and the discount applied. So this discount again can be changed over here, and we are going to provide him with syrup. So that is in one quantity. So this is out of stock, so you are not going to bill him. Um, so we will proceed with the payment details. We are selecting the payment. Once we save the payment, we can roll back the transaction if the patient or the user don't want to proceed with the uh, purchase. So we can print the bill. So a sample bill will be printed. So this again can be saved, or this can be sent to the printer for printing. So once the billing is over, when you click on the new bill, we can proceed with creating a new bill. So we can go for Arun. So Arun comes for the pharmacy for getting his drugs. So with quick search, you can able to. So if the customer or the user or the patient is not available in the system, we can proceed with just entering the patient name, capturing patient name, mobile number. So the patient ID is not mandatory for the new customers. So we are going to flow, and the required quantity is three. Going to provide him three. Add item. Chlorum, Chlorovil. So this is three for three is nine. We'll be adding this, and the system is also able to alert you if any medicine or the medical units, medical supplies which is in our inventory is going to expire. So our surgical mask is going to expire on December 31st. So it's alarming the biller that this is going to expire. So we can make a note on that and we can act upon that. So since this is a mask and I'm going to add it. Okay, the quantity is you need some 10 masks. So once the mask details are entered, we can proceed with the cache, or we can put some dummy comments over here and the same can be printed over here. So this will be the sample billing, medical billing, which is generated. So this will contain the clinic logo and the clinical pharmacy logo, or pharmacy clinical logo in the left, and pharmacy or clinic medical address in the right side, with the patient name and the invoice number, which is automatically generated, and the date of the purchase. So now I am going to log in as a admin. So once I logged in as an admin, so admin can able to do various of roles. So already we have seen walkthrough on the registration approval. So on edit roles, the admin can disable the existing roles. For example, if admin don't want to access the pharmacy or lab technician people accessing the application, they can simply deactivate them from here. If the admin want to map a user to different role, for example, this test lab, they wanted to map it as a pharmacy, give a role for pharmacy, they can able to shift the roles here, or they can disable the user for time being, or permanently delete a user from the system accessing our application. And we have a reports menu here. So we will be having a very set of reports. So when we click on the sales, we can so this matrix gives us what are the sales happen for the past 20 days, and what is the amount which so with this visualization we can able to predict what is the day which the sales is happening a lot. And we have a report for expiry medicine list. So medicines which are going to expire in next 30 days, so that will be listed here. So we have the when you hover on it, we'll get some more information on this. And we have a out of stock list report. So this is the list of medicines which are going to go out of stock in next 30 days. So we can see the quantity. So if the quantity is below 50, it will be highlighted in red. So if the quantity is below 200, all the medicines below 200 will be pulled up in this report. We also have a report for the drug or medicines, which is making a huge sale in past 10 days, so that the pharmacy users can buy and keep the medicine in stock, since that is making a very high sale in the past 10 days. And patient medicine checklist. This will list all the patient details who have purchased, who are been repeated customers and purchased medicine in the past 30 days, and they are going to, and all the medicines is going to expire. All the medicines are going to be out of stock in their hands, and they need to purchase, do a new purchase. So when we click on the send reminder, SMS or email will be sent to that, to our existing customers, in reminding them their medicine is going to expire, so that they can make a purchase. So this will make repeated customers to buy the medicines from our pharmacy. So thank you.